Hello everyone, my name is Robert Johnson. I'm a nursing student here at Nightingale College. Today I will be performing a video skill for you that is the insertion and discontinuing a peripheral IV. I am wearing my school uniform and ID as well. First things first, I went ahead and I checked the doctor's orders, and the doctor's orders confirmed that this patient, 76-year-old male, who's here only for fluid rehydration, and because of that doctor's orders, fluid rehydration, no other procedure, no blood products, anything like that. Normally, I would use a 22 gauge 1-inch needle. However, I ran out of that particular needle for this skill. So just for this practice mode, I'm going to be using the 20 gauge 1-inch needle. But normally in this kind of situation, because he's only here for fluid rehydration, I'm going to be using a 20 gauge 1-inch needle. And with that said, I'll go ahead and do my hand hygiene and get started, right? So hand hygiene, clean my hands, and I'll go ahead and put my gloves on. And let me just point out that this can over here in the corner, that is my makeshift sharps container. I do have my IV starter kit, and I have the IV extension set, which is the IV tubes, and normal saline flush is also what I have here. So I'm going to go ahead and prime this this IV tube by attaching the normal saline flush. Right, let's attach that to this one here. And actually this side, I'm going to take off those caps. Right, and we're going to attach this. And what we're doing, the goal of this is to make sure that there's no air in the tubes. So I have a trash can here on the side. So what I'm going to do is I'm going to make sure this is not clamped. And I am going to press on the plunger until I can get it about 2 drops. Yep, 2 drops there. And I am going to clamp it off. Good. Let's close the clamp. All right, I'll put that here for now, out of the way. All right, now I will go ahead and attach the tourniquet. Now, the key with the tourniquet is also, I want to mention that there's nothing that's counterindication of me putting the IV site here at this location. And what I mean by counterindication is there is no IV. I'm sorry, there is no dialysis fistula here, or no dialysis port or anything like that on this part of the arm. Or there was no mastectomy on this part of the arm, so there's no skin irritation or anything like that. Nothing is counterindicated, so I will use this area. I'll put the tourniquet on, and I want to make sure that the tourniquet is not too tight when I tie this up. So I will go ahead and put the tourniquet there, and I'm going to be filling for a distal post. This is a way to make sure that I still have a distal post and this is not too tight. Everything looks good. I'll go ahead and clean the site with alcohol, and because I have alcohol, I'm going to put that in the trash. I'm going to clean in a circular motion, starting from the center and working my way out to the area of where the IV will be inserted, right? Working my way out. I'm going to let that dry. Let's put that in the trash can. I'm going to let that dry, and while that's happening, I'll go ahead and get the IV catheter ready. Let's take the top off. Good. All right, let's see if the cap is still in there. Good, that's there. Right, so I took the cap off while I was holding on to it as I was taking off the paper, just FYI. So I want to make sure that the bevel is up when I put this in, and I'm going to be holding this with my index finger and my middle finger. My thumb and my middle finger. The index finger will work as a guide to feed that off, right? So I do need to anchor the vein. The way I'm going to anchor the vein is I am going to use my thumb and hold down or taunt the skin, and I'm going to come in at 30 degrees slowly, at a 30 degrees angle, slowly. And once I'm actually in, right, 30 degrees, wait for flashback. I do see a flashback. Now I'm going to lower the angle a little bit to level off. and proceed in at least a 1/4 inch. And then from there, I will go ahead and feed off the catheter there. And we're going to release the needle. Good. And I'm going to place this in a sharps container. I'm going to loosen up my tourniquet. And I'm going to attach my normal saline. Attach the normal saline. Make sure that it's not clamped. Good, it's not clamped. I'm going to aspirate on the syringe for blood. Good, I see blood. Now I'm going to flush the actual catheter. We're going to flush that there. Good. Now while I'm flushing, what I'm doing is I'm checking the site, making sure that there's no blebs or no sign of infiltration. I'm also looking for any type of discoloration or any type of rising of the skin or anything that looks like the fluid is maybe in the wrong spot. Right, but everything looks good from there. Good. So what I'm going to do now is I'm going to remove the normal saline and I'm going to clamp it off. Okay, that's clamped. Now I am going to apply the transparent dressing, the sterile dressing here. And what I'm doing with this dressing is I'm making sure that I put it in the area where it is, oops, sorry. I'm going to put it in the area where it is, this is my last one, so yeah. I'm going to put it in an area where it's not covering the tube, but it is securely covering the connection and the port, like right at the edge there, right? And I want to remove the edges of that one there. Just remove the edge, right, of the transparent dressing. And let's go all the way here to this other side. Let's take the other side off. Good. Now on this other piece, there's an actual label here. Now what this label is, I'm going to be putting my initials. I'm going to be putting the date, the time, the size, like the gauge, and the size of the needle. So let's go ahead and label this one here. Let's put that label there. And we're going to put that right on the transparent dressing there. Now the other part of the tube, like I said, it is clamped off. And I want to tape this to a secure location, but I want to make sure that I close it first. Make sure that that's closed with a sterile cap, a sterile port cap, right? We want to make sure that that's closed off, right? And I want to tape. Make sure that that's not in the way, that little clamp area. Good. And I want to tape this one to the skin, but I want to make sure that it's not taped in an area where the it's not covering the transparent dressing, right? That's where I want to tape it, right? So we want to tape that one right there. Transparent dressing is not covered. Everything looks good there. Okay. Now from there, I will go ahead and clean up my area. Get rid of all these items, put that stuff in the trash. Any sharps or anything left behind, I'll put that also in the trash. Okay. And then from there, I'll remove completely, get that out of the way. And I will do hand hygiene. Hand hygiene. And then I'll document this procedure. Now, it's a week later. The patient's back. There's an order to remove. Let's get that stuff. The patient's back. There's an order to remove the peripheral catheter. So what I'll do is I'll make sure that I do hand hygiene first. Over here on this side, hand hygiene. Then I'll put my gloves on. And what I'm going to do is first things first is I am going to slowly remove the transparent dressing, but I want to make sure that I secure the catheter, making sure that I'm not pulling out on that one. Right, slowly remove the transparent dressing. right? You don't want to pull anything too fast, cause any kind of discomfort to the patient. Put that there on the chucks. And also I want to take off the tape. Slowly take off the tape. Okay, let's take out that tape. Now, I'm going to get a sterile dressing out of my kit. And I'm going to put a little bit of pressure right there where the insertion site is. And I'm going to cover that up and pull out the catheter. Here we are. Now, what I'm doing is I'm going to hold down on this, on the gauze, the sterile gauze, for at least about 30 seconds. Apply pressure in case there's any bleeding. While I'm doing that, I'm checking the actual tip of this for the integrity of the tip, making sure that there is nothing like it's short or anything like it broken off. Everything looks good. It still looks like it's 1 inch. I'm going to put that in the sharps container. Let's put that out of the way, right? And from there, I am going to get another sterile dressing, sterile gauze, and I'm going to replace this one that's there, right? And let's fold that a little, and let's put the new one there, put that one in the trash. Now from there, I'm going to get some tape and tape it off. Let's see here. Okay. There we go. Okay. All right. And I will, patient, you're okay, sir? Everything's good? Okay. Now from there, I'll go and clean up this area. Clean up this area. Get rid of any sharps or anything like that. Then I will do hand hygiene, and then I'll document the procedure. Thank you very much.